Welcome, everybody. This is PJ Valentini here on another episode of Health Connect Partners Presents Supply Chain Connect. We have with us today a very, very special guest who I'm going to let him introduce himself in just a moment. But we hope that this episode provides you with some great insights. And again, thank you for tuning in. We appreciate you all. So we have with us a very special guest. Tell me a little bit your name, who you are, and where you're working currently.
Sure. Greg Goddard, Division Vice President of Supply Chain for ScionHealth. We have 68 hospitals currently across the country. Most of them are specialty long-term acute care facilities, and then we also have community hospitals as well.
Very nice. So nice, large organization. So obviously you've been in supply chain for a very long time. I'm sure you're very, very passionate about this industry. And so, we always ask, a very important question when we have these episodes. And so what I wanted to talk to you a little bit about today and ask you is tell me a topic in supply chain that really you're intensely passionate about. And we'd love to hear some of your insights on that topic.
Yeah, I think this topic really became front of mind probably during COVID more than anything, but trying to build a resilient supply chain whenever you have such a large geographic footprint is definitely a challenge. I know there are a lot of companies that do have a large geography and they try to tackle it in multiple ways. We ended up finding ways to leverage our distributor relationship along with 3PLs and kind of secondary relationships to really build a resilient supply chain. And I think a lot of supply chains right now are thinking about resiliency, and in light of the political landscape and kind of where we see things going from a price perspective, they're really working on how do we leverage existing relationships and create new ones that help us maintain our supply chain resiliency during some of these difficult challenges.
Let me ask you a quick follow-up question. You talked about obviously developing, secondary and third level partnerships. How were you guys able to do that? Obviously, there's a lot of, contractual obligations when you're working with a large vendor. How were you guys able to kind of navigate through that? Was it just specific to something that obviously you saw it during COVID and that there was a need for it? And now obviously there's different aspects, different disruptions going on. But how did you guys forge those kind of secondary and third level relationships?
Yeah, so I think as you might guess, whenever you have a national footprint, even with a primary distributor, you're serviced out of many distributing locations. So obviously, your primary distributor has warehouses throughout the country. And one of the things that we did very quickly and very early on is we realized, hey, we're going to have to do some of our own sourcing to kind of backfill the funnel. And honestly, we continue to do this. And whenever there's a long-term back order, we tried to create strategic 3PLs with our existing distributor that allowed us to have strategic stock in a strategic place. And we kind of tried to pick warehouses that serviced the most facilities in the general vicinity to try to reduce those transportation costs and to leverage larger warehouses that could take the volume that we wanted to put through it. But I think in addition to that, it was also building kind of a strategic secondary, and then I would say even a third level relationship where you're able to have a contract with additional suppliers, but at the same time maintain your commitment to your primary distributor. Because the one thing you don't want to do is dilute that
Sure.
that primary distribution partner, or they might not want to be such a good partner in the future. And we actually built our 3PL with our primary distribution partner. It made sense, and it kind of helped with that. Hey, I'm going to have to go to another market to get this product, but you guys aren't getting cut completely out of it because you're going to be paid to stock and maintain and distribute that product for us. So it's really a nice relationship, and they have some skin in the game to help make sure that program really works for us.
Wow. Well, no, that's brilliant work, especially around the warehousing piece as well, where you talked about being able to, use warehouses that were in the vicinity of many facilities to be able to cut costs on transportation. That's very crafty, and that's definitely thinking outside the box. So well done, and kudos to you and your team for being able to execute that at a high level. Um, So I'm gonna fun up the mood a little bit here, and fantastic insights on that, Greg. So thank you very much for sharing that. What
Thank
I
you.
would like to talk to you about is obviously, people see you, you're a highly visible gentleman. You come to a lot of conferences, and so if there was something you could tell people about you, a little fun tidbit about yourself, what would that be?
Oh, okay. So I thought about this a little bit, and it's something that quite honestly I'm very proud to be a part of. So in 2021, actually, interestingly enough, right before the war started in Ukraine, my wife and I started a nonprofit organization that works with orphanages and foster families in Ukraine. We adopted two girls from there in 2019 and really kind of fell in love with the people, the country, made a lot of connections, and we wanted to leverage that. So, at least once a year for a couple of weeks, you'll see me posting on Facebook pictures of me in the mountains with the kids for kind of a summer retreat. And right now, that's really important for them because it gets them out of the city and the constant, duck and cover to being able to just be kids and enjoy themselves in the Carpathian Mountains. So that is kind of a unique fact about me and something that most people don't know.
Thank you so much, Greg, for being here with us today. Really appreciate your insight. I want to first off, let me ask you, Greg, will we be seeing you in Las Vegas in the fall?
That is the plan. I am
All right.
registered and ready to go.
Very good, sir. Well, we'll be looking forward to seeing you. And of course, we know we'll have a lot of people that want to meet you and get a chance to speak with you there. Um, just a little reminder for the audience here. We will be running our hospital supply chain and quad events in Las Vegas at the Westgate this year, October 12th through the 14th. So we hope to see all of you there. Greg, again, big thanks to you for being here today. And again, I want to acknowledge all the work you're doing in the hospital supply chain industry, but also the work you're doing also with the beautiful children of Ukraine as well. And we thank you for your support to those people. Um,
Thank you.
I'll sign off now. And again, thank you so much, everybody, for tuning in to another episode of Health Connect Partners presents Supply Chain Connect. We'll see you soon.